want to get into some of the harms and problems associated with these hormonal contraceptives. So I'm just going to start with this, Mike. One of the things that concerns me are that the oral contraceptives deplete the body of important vitamins and minerals, B vitamins, which are necessary cofactors in neurotransmitter production, and the essential trace elements selenium, magnesium, phosphorus, and zinc can plummet with continuous use of the hormonal birth control. Meanwhile, candium, calcium, iron, copper levels may lead to a multitude of ailments, including fatigue, depression, PMS, insomnia, headaches, hypertension. All those are like real legitimate problems and things that I see in clinical practice way too often that end up getting attributed to a condition like anxiety or depression, right? When you medicalize and you create a disease called major depressive disorder or generalized anxiety disorder, no longer are they symptoms of something else. They're a disease in itself that people begin to attribute their own struggles, their emotional struggles to that disease when in turn they don't even ever think that it could be tied to the fact that they were placed on oral contraceptives.
Yeah, and especially when you have doctors, again, saying it's impossible, this is not affecting you, even though you can see that clearly right after you started taking it, your whole personality changed, right? Um, one of the there's a Danish study that came out. One came out in 2016, and then the follow-up came out in 2017. And one of the things I love about them is they have a national registry, so they're looking at over 1 million women, when they come up with this data. And they found that women who took birth control were 70% more likely to suffer from depression. The follow-up study found that women who took birth control were 3 times more likely to commit suicide. So it kind of follows up again. If you go back to the Nelson pill hearings, there was a doctor, Dr. Giles Boyle, I believe, who testified he was seeing major depression in women who were taking the pill. And not only were more women who took the pill experiencing depression, but the level of depression that they were experiencing was much higher. There were many more suicide attempts. And so that was late 60s to today. It's the same trend. The data hasn't changed. There's really nobody who's disputing it. So, at what point does it become criminal to keep sweeping it under the rug and denying that there's that there's a problem? And whenever studies like this come out, you always see in these articles that, say the Danish study found this, you always see a doctor who's willing to say, well, the benefits still outweigh the risk. And my mind always goes back to their benefit risk paradigm. It's like benefit to who, risk to whom.
Yeah.
I hate seeing that, but in my mind, it's like, okay, that must still be their mentality. It's the benefit to society is still great enough to be willing to accept these. And I always want to say, okay, so what's the benchmark? How many women are we willing to sacrifice before we say, okay, maybe the benefits don't outweigh the risks?
Yeah, and I go back to that risk. It has to come down to the individual. The individual decides how much risk they're willing to tolerate. And I don't know if it was the same Danish study, but when it came to depression, there was just one little, blurb in there about, especially among adolescents. And when we think about women going on birth control, I'm thinking about like when I was in high school, it was like girls would turn 15 or 16 and immediately go on birth control. They're not even sexually active. They were just taking birth control because it was like the next thing that somebody does the moment they start having a menstrual cycle.
Because I think it was pushed by their doctor.
Yeah, or for acne. Yep.
Yeah, I mean, I think this is really pushed by their doctors. So some of the things that have been, told to my own daughters is that this is a kind of a treatment for PMS, so having the symptoms premenstrual.
Yep.
To regulate your period if you're having like heavy periods or a number of other things.
Really strong abdominal cramping is what I recall a lot of girls going on it.
They're talking about regulating mood.
Mm-hmm.
Like this is some advancement as a health intervention, women's health intervention that improves a number of areas, including acne, as Mike mentioned. So these girls are being placed on oral contraceptive not to prevent pregnancy. They're being placed to treat other conditions that, again, it has not been approved for. It is not adequately studied, and the harms and risks are not communicated to the patient and the family.
Yeah, and so I'll turn it to kind of the tragedy of this. You may say, what risk is the woman willing to accept? But exactly that makes me think of this one woman who reached out to me when I started writing articles and was sharing with me the story of her daughter. Her daughter was getting ready to turn 16, and she was having trouble with her acne. And she talked her mom into letting her go on birth control to try to get her face cleared up before her 16th birthday. And so she went with her daughter. The doctor prescribed what he promised was the lowest, safest dose possible. The mother agreed. And so she started taking it. And a few weeks later, before her 16th birthday, she died from blood clots
Mm.
before her 16th birthday. And the mother shared that story with me. And she was doing, she was writing articles, she was, advocating, she was doing anything she could to try to make other women aware of just how dangerous these drugs were. And a couple of years later, I got an email from another mother who lost a daughter telling me that Laura had committed suicide on Thanksgiving morning. And so, there's no way of measuring kind of the layers of tragedy to these drugs. You lost the daughter, and then you lost the mother from the grief. And she's the second mother I know that committed suicide from kind of the guilt of having allowed her daughter. So there's really no way to measure the damage these drugs are doing. It's impossible. And really, and that's, ultimately one of the things I say is I'm just trying to push informed consent, because
Yeah.
everything's supposed to be based on informed consent. And without that, it's all just smoke and mirrors. Right. And I would love for birth control to get to a point where, where like tobacco smoke is. If somebody's still smoking today, we can feel pretty comfortable that they've been warned and they know the risks that they're really jumping into. I'm not sure women are anywhere near knowing the kind of risks they're jumping into when they agree to take birth control.
I was looking into the stroke and hypertension, and I thought the percentage was really going to be low. I was actually surprised when it said 4 to 5% of healthy women will, exacerbate hypertension. But if you have like a pre-existing condition, like with hypertension, which probably could be, like diet related, if you're a little bit overweight, that goes up to like 9 to 16%, putting you at risk. And that's significant enough that should be coming into the conversation very early on, before you decide to go on it. The other factor with adolescents, I don't have any data behind this, but I would imagine there's a large percentage of girls that are going on birth control. Their parents aren't even aware, because you can just go to a Planned Parenthood,
Right.
and you can go on the oral contraceptive. I just recall, girlfriends in high school and college just going to Planned Parenthood and getting the pill.
Yeah. Yeah. That happens a lot. And I mean, not to jump into too many stories, but there's another story that I do share in the book. A gentleman who uh, found one of my articles, and he realized it had been written on the same day his daughter died. He found it a couple of weeks later, and contacted me and asked if he could talk. And for me, that was that was the first time I really, I'd met a lot of parents and talked to them who had told me the stories of their daughters. But by the time I met them, those stories were kind of already their past tense, and they still hurt and they're terrible stories, obviously. But I never gone through it with a family member who was still raw with pain. And so this father reached out to me and asked if he could talk. And he said he liked talking to me because he was avoiding all of his close friends and family because he was afraid if they said something wrong, it might damage their relationship forever. So it was nice to have a stranger to kind of go through it with. But he was telling me about his daughter was 20 and she had gone to Planned Parenthood. They didn't even know she was on birth control until she was dead. Um, but she had started, and I see this all the time. She had gone in with back pain. The doctors give her a muscle relaxer. They thought she must have pulled it at work. And then she started having trouble with her lungs, trouble breathing. They give her an antibiotic, told her she probably had, just some sort of viral infection or whatever. And then she was at home one morning. A repairman was coming. She went outside and collapsed on the driveway and died. And then they discovered she was on birth control. And the father he was experiencing guilt. It's like, I should have had conversations with her. I should have warned her. And then he was like, but, Googling it, he said, I realized I was at a disadvantage because when you Google it, all you see are all these great stories about how wonderful it is for this or that. And there are nothing, it's really, unless you know specifically what you're looking for, it's hard to find the negative things about birth control. So we're all at a disadvantage on getting this information properly. And then, you just, it's one of the things that continues to drive me. I have this image of him telling me about sitting in the hospital at Duke University, and his wife is telling him about sitting on the driveway, holding their daughter's hand, waiting for the ambulance to come that morning. And all he could picture was his daughters learning to ride bicycles on that same driveway. And just that image shattered my heart. And still, it's one of those things that keeps driving me to, okay, these things, we need to get the word out about these, and we need to do whatever we can to make sure women know, how many, one of the drug inserts, one of the patient insert or pamphlets says 1 in 12,000 women will die from, I think it's in Seasonique, 1 in 12,000 women will die from blood clots from using this drug. Well, if you consider 15 million women taking it in the United States, that's 3 women a day dying from blood clots. That's not insignificant.
Yeah, that is significant. And so let's just be clear about what is actually happening. The hormones, or the synthetic hormones in birth control pills, do suppress a woman's body's production of estrogen, their natural production of estrogen and progesterone, through this negative feedback loop mechanism. And as we've talked with other professionals regarding the impact of like an SSRI or another psychiatric drug, what happens when you chemically induce a change in the body? It affects the entire body. Birth control pills flood bodies with high doses of artificial estrogen and progesterone, causing the natural hormones to turn off, preventing ovulation, thinning the uterine lining. And this leads to hormonal imbalances, such as like estrogen dominance. And so then what are the consequences of having this disrupted hormone balance, something that is just natural, that has evolved over centuries of human evolution? And I come to the conclusion that what we've been doing the last 60 years is just a mass experimentation on human beings.
Yeah, I think it absolutely is. Even one of the doctors at the Nelson Pill hearing said that. He said exactly that. He said, this is a mass experiment, and women who are going on this need to be warned as such.
There's a TED Talk, Mike, I don't know if you're familiar with it. I think her name is Sarah Hill, that was looking at women's brains on birth control.
Yeah, she's an author of a book. I read the book.
Oh, you did? Okay.
Yeah.
So she was looking at how when a woman goes on birth control, I guess the natural cycle is during certain periods of the month. Maybe it's when estrogen's increasing. So the first half of the month, women are more drawn and attracted to men with testosterone, like higher testosterone. So she was looking at a study of people's faces that had more masculine and feminine features, and it was affecting the way that women were attracted to a partner sexually, which I thought was really interesting to show how it affects the brain.
Yeah, not only that, she has a lot of research that supports that once a woman would get off the pill, it would affect their marriages because it changes who you're attracted to. So the birth control pill can decrease sexual desire by suppressing testosterone. And it has been proven that women who are on oral contraceptives are more likely to be attractive to more feminine men. But once you stop the drug, it changes how you feel about your own partner that you might have chosen. It's fascinating research. You are changing the personality. You're changing the person. We are a collection of like all our hormones and our chemicals and our personality, our experiences. I mean, it's just so complex. We don't even scratch the surface in understanding the human condition, right? But synthetically changing the human body has real significant consequences that we're just not talking about. It's absolutely shocking to me. And as men, I mean, I was never involved in this conversation. When I have 2 daughters, and I've kind of taken a vow to not talk about their particular circumstances on the pill today, so I protect their privacy. But this was a conversation that was between my wife and their OB, their physician, and any of the risks were certainly not discussed. And then once you start learning more, because I believe we are part of an awakening right now, we are starting to become more aware of pharmaceutical, industrial, and political corruption in these drugs. And we're starting to understand more about what the consequences are. And healthcare professionals across discipline have to be aware of this history. They have to be aware of how these
Right.
drugs have come to market and the way it's impacting our collective humanity emotionally, physically. But we're not told. So you're actually just considering that this is almost like a vitamin. Like it's shocking how it's communicated from our physicians to patients. Not only do they just minimize any potential risks, they're talking about it entirely in benefits, as it's something that's going to enhance your body and well-being. And my question to Mike is trying to understand, like, how did we get here as a culture? How do our medical professionals, who are some of the brightest people in American society, obviously have just really succeeded throughout their academic history, how do they get to a point where they so blindly just repeat the marketing propaganda?
Well, I think you hit the nail on the head. I used to say that they handed out the pill like it was candy, but I think, with candy, we at least have some notion that it's ultimately not good for you.